And then that's the whole point. And that's the whole point of this. And then I'm trying to share my screen with you guys so that we can get on with yeah, here we go.
Can we just wait for 5 more minutes for a few people to join in? You can share your screen.
Yeah, we can.
So in that 5 minutes, we'll just introduce ourselves about what we are
Yeah,
doing, and yeah,
yeah, that would be great.
yeah. You can start, Satish.
Yeah. So yeah, that's about me. I've been doing emergency medicine quite long. So I'm from the first batch of 2014. So we completed in 2017, and I've been in emergency since then. And then I'm happy to see Pranav here. Hi, Pranav. I heard you.
Hi, sir. How are you?
I'm good, and I'm glad you guys are all doing so great.
Yes, yes. All because of good seniors like you.
Thank you for your kind words.
Yes, sir.
Over on to you, Harsha. You can introduce yourself.
Hi, I'm Dr. Harshavardhini Patel. I am also from the first batch of DNB emergency medicine. We all stepped out with awe factor for emergency, not knowing what exactly is emergency. But yeah, it's been a long journey so far. I currently am working as a consultant in St. John's Medical College for critical care medicine, and I've been practicing emergency medicine and critical care medicine. So this is just a look back to my roots. The whole ADRE Rush EM is looking back to my roots. So then,
Yeah.
Yeah, Bhuvi,
Yeah.
about you?
Yeah, I'm Dr. Bhuvaneshwari Raja. I'm an emergency and critical care physician. Currently, I'm the head of emergency in Manipal Hospital, Bhubaneswar, and also an associate in critical care. So I've been in emergency for around 7 years now, like Satish and Harsha. And we are very happy to be in this program because when we started, we didn't have much guidance because we were the first batch, and there were not much of materials or resources for exams as well as for clinical practice, evidence-based practice. Though we were in a good institution with great number of cases, good seniors, good mentors, like we didn't have time for academics, and we didn't have a lot of support for evidence based emergency medicine. Like nobody was there to guide us. So our ultimate goal was to like help out all the juniors who are out there like us, like lost in the group or lost in the busy schedules. We just wanted to help all of you, like whomever is interested, to take that support and shine. That is about it. So we'll be
NB
starting.
protocol, the current NB, whatever competence base has come, I think after our batch, it's come like
Yes.
recently, if I'm not wrong.
Yes.
Our
Yes.
batch we didn't even have a log book. We knew only that we have to read internally book. And the first paper was the most scary day of our lives.
Yes. They could ask anything. They could ask anything.
Yeah. So this is our way to try and help out all of you to overcome the obstacles what we have faced.
Yeah, as much as possible with the recent evidences. And we want you to shine as a good academic person as well as a good practicing person. Like, there shouldn't be any mismatch between you and critical care people or any other department. You should know at par to their levels because you people are capable to know that. That we realized very later when we got the support and guidance from good people later.
So I think we can go ahead now.
Yeah, yeah.
Yeah.
Satish, you can start with the session if you are ready.
Yes, I'm ready. So let's go ahead. So welcome to ADRE EM. You can all see my screen.
The screen is not yet shared, like the PPT is not yet shared.
Oh, okay. Just a minute. Let me share it. Uh,
So bottom fourth option is
Yeah,
share.
yeah, yeah.
Yeah.
Yes, I'm trying
You have
to
to open the
share.
PPT and select that window.
Yes, I tried that. Just a minute. Okay, I think, yeah, that's gone down. Yeah, got it.
Yes.
Yeah?
Yeah, yeah. Put it on slideshow and you can start.
Yes. Yes, here we go.
Yes.
So at Rush EM, so we are starting an evidence-based emergency medicine e-learning platform. So this, our aim is to cater to all your emergency care practice needs, whether you're on clinical floor, whether you're practicals, whether with exams. We want to help you guide through all these things, and then with evidence, with backed with good evidence. What is the current evidence and where we stand with things. And then, as you know, it's a very rapidly evolving branch. There's a lot of new evidence coming up. And then it is a well-established specialty. And then I predict that it's going to do very well in coming years. So our vision is to create cutting-edge technology-based, evidence-based course in emergency medicine that will help everyone in practicing emergency medicine across the whole breadth of the country. And then our mission is to provide high quality evidence-based teaching. And then we would like uh, we would like to provide a comprehensive coverage, which which is exam-based as well, because I know most of you guys wants to give exams and then you want to shine in those exams. So we have compiled courses covering all the topics, and we'll be conducting mock tests, and then there'll be emphasis on previous year's exams and questions. And then we'll also cover practical aspects, ACLS, ATLS, procedures, and all these things. And then we'll be available 24 hours 7. I mean, time zones, I always thought time zones are tough, but it's easy now because Bhuvi and Harsha are in one time zone and I'm in one time zone. So there is someone always to respond to you guys. Please don't mind that. I'm in hospital. That's why you might hear some noises. And then coming to our modules, I'm going to briefly touch on our modules, what we're going to cover, so that you have a basic idea of what you are getting into. So coming to cardiovascular system, the most important system, I would say, we're going to cover ACS, hypertensive emergencies, inflammatory heart diseases, arrhythmias, valvular emergencies, heart failure, defibrillation, and cardioversion, cardiac arrest, and CPR theories. I'm sure Bhuvi and Harsha might remember. They asked us CPR theories in the first exam, and we were like, "What? We know what is CPR. We never knew what are CPR theories. What should we write?" So that post cardiac arrest care and obviously procedures. We'll cover procedures in each system, and then we compiled a procedure list, what you need to know, and then we will cover them comprehensively. So I'm going to skip the procedures in the rest of the systems. And then respiratory, pleural diseases, ARDS, mechanical ventilation in ARDS, strategies of ventilation ARDS, and then where do we stand at this point, and then pulmonary embolism, pneumonia, COPD, and asthma, along with touching with non-invasive ventilation, invasive ventilation, initiation of mechanical ventilation in these patients, and then with emphasis on oxygenation, along with basics of physiology of oxygenation. And then neurology, obviously, management of stroke, infections, CVA, neuromuscular disorders, spinal disorders, including spinal disorders, and then acute onset headache. And then GIT, renal, we're going to cover all acute abdominal emergencies, both medical and surgical emergencies, hepatic diseases, acute kidney injury, chronic kidney injury, CKD, renal replacement therapy, and then metabolic emergencies as well, like DKA. DKA, Addisonian crisis, and then all endocrine emergencies. And coming to obstetrics and pediatrics, I know you might be practicing pediatrics or not, but through this course, we'll help you get through the pediatrics because it's an important aspect of emergency, and then you will be asked to see pediatric patients at some point of time in your career. So we're going to cover how to approach a crying baby, what are the pediatric conditions which you should be worried, which you should not be worried. And when we cover cardiac arrest, we're going to cover obstetrics and pediatric cardiac arrest as well. And then we're going to cover trauma in both pediatrics and obstetric patients, and we're going to cover bleeding in pregnancies, hypertensive disorders in pregnancy, and we're going to cover non-pregnant emergencies as well, like gynecological emergencies as well through our course. And then trauma, ATLS, we're going to cover in and out of ATLS, including chest trauma, abdominal trauma, neurological trauma, and orthopedic trauma, and urogenital trauma as well. And then toxicology, we're going to cover principles of toxicology, including withdrawals, burns, temperature-related emergencies, altitude-related emergencies. And so that will cover toxicology. And we will also emphasize on specific toxins as well, which are important and which you see in day-to-day practice. And we'll also briefly touch on the rare toxins so that you're not caught off guard when someone asks you in exam or in a practical, because there is always an off chance of having one or two rare things in practice and even in exams. And then sepsis, we're going to cover an approach to sepsis along with an empirical antibiotic cover, which is in line with current medical council guidelines. And then we're going to cover tropical fevers, and we're going to cover miscellaneous infections, skin infections, soft tissue infections as well. And then coming to hematology and oncology, we'll cover anemia, both acquired anemia and congenital anemias, and then approach to bleeding patients, anticoagulation and their reversal. We're going to touch on major hemorrhage protocols, bloods and blood products, drugs, and then we're going to cover both oncological and hematological emergencies, which because now I think infections are coming down and cancers are going up as lifestyle changes. So we're going to cover that as well. And then along with that, we're going to cover eye emergencies, ENT emergencies, and psychiatry and dermatology as well. Each time you'll have one, or although you see less often in emergency room, but you do still see these emergencies, although they directly go to specialty centers, but it is important from the exam perspective. And then at the end of each module, we're going to conduct a mock test. We're going to give you a mock test, and then we're going to give a day for you to answer the mock test, and then we're going to give you the answer key, and then we are available to discuss this mock test. And then we're going to do case-based discussions on how to approach things. And at the end of the course, we're going to give 2 grand mock tests so that you are exam prepared, and then we are available 24/7, as I told. So I think that would be from me, because I don't want to take too much of your guys' time, because we have a very wonderful session planned ahead by Dr. Harsha. I know that. And then with that, do you guys have any questions for me?
Yeah, please do ask, because this is a time where you can ask whatever doubts you have about the course and how we are going to go ahead. We are ready to answer. We are happy to answer, to clear your doubts.
Yeah, or if you guys want to reserve your questions to the last, even we are happy with that. And you can, I'm not sure whether you can drop in a message. Can they
Yeah, they
drop in a
can. They can.
message?
In the
Can,
chat
they
box,
can,
they
can.
can. Yes, yes.
Yeah, so drop in a message if you want, if you think that something comes to your mind and you'll forget, drop in a message so that we'll be able to answer that. Yeah, shall we move ahead then?
Yes, guys.